is Florian Kongoli from FLOGEN Technologies. That is one of the main sponsors of the meeting. Please, Florian.
Yeah, thank you. So, good evening, good afternoon, good late afternoon, again on stage. It's a presentation probably is a little bit different from what you heard until now. This comes from the fact that sustainability is a word of everybody and every government and every local government, but nothing has been said about molecular science and also drug development. What does it mean? What's sustainability? How is it related with drug developments and molecular science? This is the subject of my presentation, and as you see there, it's FLOGEN Sustainability Framework. This we have developed in 2015. It was published in 2016. It is completely different from what you have seen or normally what you see around. It's completely original, and I'm happy to say that in September last year, this was applied as a law in one of the cities in Brazil. Every project has to pass the criteria of FLOGEN Sustainability Framework in order to be applied. And there is a reason for that, which I explained in the framework of drug development. So there are, you hear about sustainability, but you hear only environment. Environmentalism and sustainability are totally different things. To be sustainable, there are three criteria to be fulfilled simultaneously. They are environmental protection, economic development, and social development. Any one of those is not fulfilled, we are not sustainable. What happened until now, we were focused on industrial revolution and forgot the environment. But then we went to another extreme. We went to the environment, we forgot economic development. And then, so politicians were jumping from one extreme to the other. Then the crisis, economic crisis came. That's all important. It's so important, the economy. So if, and then sometimes on behalf of the environment, we forgot the quality of quality of life of human being. So if you are not balanced, you jump from one subject to the other, from one extreme to the other, and you are not sustainable. Huge confusion in literature. I'm not going into details. There are so many. Everybody puts it in terms of sustainability, government, the culture, the human rights, etc. Everything is important. The issue is how this differentiates. And this was a confusion that made us differentiate things. Differentiate criteria and actors or pillars. And did you see, the first pillar for us is science and technology. This makes or makes sustainability. So hinder or makes sustainability as it should. But also this is governance in terms of politics, but also in terms of managing a company. And then is also the education of the educating new generation. We will not be able to be sustainable. So these are three pillars. And if they are equally important. So imagine a table of three pillars, and any of those pillars goes down, the whole structure goes down. So there should be a cooperation between sorry, I'm going to go a little bit. So this is this is very important. In order to be sustainable. I'm missing the table here, but it will come. Sorry. So now, in order to be sustainable, as I said, we have three criteria and three pillars. Okay? David Joseph will present after me his invention, his discovery on BB2 for BB2 protein deamidation, and this is one of the examples of sustainability in molecular science and in drug development. How this affects? So it is one switch, common switch to cure and to refrain Alzheimer's, Parkinson's, and other brain-related diseases. And using this switch. So why this is sustainable? Because because in terms of the criteria, we improve the quality of human life, and on the other criteria, the economic development, we decrease the cost considerably. And on the other side, environmental protection increases the number of sources needed to produce a medicine. So it could be the best medicine in the world if it is not cost affordable. It is rarely used. There are many examples today. There are medicine against cancer that might cost $100,000, only one dose. How many people are able to use it? It could be the best technology ever. If it is too expensive, then it's not sustainable. So, Professor Takahashi yesterday mentioned a very important point: the speed of drug development. And he said, to produce a drug takes more than 10 years. 10 years to produce a drug. And then a cost, it is between 1 to 2 or 3 billion US dollars. And I took his permission to reproduce his figure. And you can see, producing a drug might take, such amount of time that many people would have died already. So this is not sustainable. How to make it sustainable? There are many ways of doing it, through using AI, using different technologies, and David Joseph said that he will present his discovery after me. You will see that he developed the theory in 2 weeks. He experimentally verified it in about 3 months, and then it is now it is just to validate and to actually in Professor Takahashi's SEMA is in the stage 5. So these are very important. This is very important. So, as I mentioned, there are 3 different criteria and 3 different pillars. So first of all, the science and technology, governance, legislative, juridical, but also within managing a company, and education, because we need the future generation to develop the drugs. Now, this is the famous FLOGEN Sustainability Framework. There are 3 criteria. In order to be sustainable, we have to fulfill them simultaneously. Any one of those is not fulfilled, we're not sustainable. How to achieve it? First is science and technology, but we need the government. Sometimes researchers need money. Without money, you cannot succeed and produce drugs faster. So that's the key point. And the other one, you need students and young generation. So any of those pillars goes down, the whole structure goes down. So the extremes are avoided if the politicians that follow this scene will not have any economic crisis, we will not have any extremes that we see today. Why? Because it doesn't allow you to go to extremes. And that's why this is now law in one of the cities in Brazil, and then the other cities are adopting it. So now this is a little bit different way of looking at sustainability, very short, although it's not related directly with the drug development, but it is closely related to this. So, what is the chances that in the airplane, you take an airplane and die? It is 1 in a million. If you go in the hospital, what is the chance if you die because of an error? 1 in 300. This is according to World Health Organization, not my data. So it's a huge, huge problem. In high-income countries, 1 in 10 patients is harmed while receiving hospital care, 10%. In low and middle-income countries, strangely, it's lower, it's 8%. So, and 83% of the errors would have been avoided, and 30% lead to death. So we're saying that we are a modern society today, but if you go to the hospital, your chances to die because of error is 1 in 300. Okay? So now, 1 in every 3 patients admitted to the hospital in high-income countries each year are harmed during the stay. And they can die. 50% of the cases where people were harmed were prevented. And malpractice is really all over the place. And there is no differentiation between high-income countries and low-income countries. Strangely enough, low-income countries has a lower case of malpractice. Now, in Canada, the number of malpractice cases that have been decided in favor, this is a legal point of view. Okay, with practical point of view, healthcare situation, drug development, drug errors, but what about the legal aspect? If there is a malpractice, historically, the number of malpractice cases that have been decided in favor of the patient has decreased considerably over time. From 2014 to 19, only 1 in 5 cases of malpractice that went to court was decided in favor of a patient. And in the late 70s, it was 1 in 3 was decided in the favor of the patient. So that's not sustainable. Between 2013 and 17, in Canada, 52% of the malpractice cases were dismissed, discontinued, or abandoned. 37% almost settled. 6.5% are decided in court in favor of the doctor, and only 1.6% have been decided in court in favor of the patient. So you see that the patient the patient could be a doctor in himself, in him or herself. Doctors are themselves patients. In the United States, there is no statistical information available on court decisions, but the National Institute of Health says that 96% of successful medical malpractice claims are settled out. Now, this is a very bleak situation. You see that medical practice and crimes are very rarely prosecuted. Legal costs are high. Complexity for a jury to understand it is sometimes unbearable. They cannot understand the complexities and the details. Medical competency of lawyers is the problem. Many lawyers have no medical background. They don't know what they're speaking about. And it's very difficult to convince the judge. And the availability of lawyers is a problem also. Many of the lawyers have been worked for in different hospitals and then they have conflict of interest if they go against the hospital in court. And the length of the legal processes is a big issue. Sure, the choice of the legal arguments is another one. Now, so many problems and legal issues. So, what is the solution? It's a paradox. Why? Because a university, we have so many problems, and they solve that. To solve this problem is to change the criteria of accepting medical students at medical faculties in any university. So they said, we should ask students we should decide not only on their ability on science, on medicine, and exact science and biology, but they need to know many non-academic skills. And they, strangely enough, invented medical college admission test, MCAT. So, it's a computer-based assessment for sampling personal characteristics and has 30% weight in the admission criteria. So if you are the best student in medicine, in math, in physics, in chemistry, if you don't pass 30% is decided because of this test, which has nothing to do with medicine. And what are the test criteria, by the way? What are the non-medical criteria to be decided? And then you'll see here. One question is, I am invited to a party by a feminist organizer. Should I bring with me my friend that makes misogynic jokes? So this is one of the questions asked. It is perceived as masculine to go in a paternity leave? It's another question. My friend goes in a sick leave, but I see a photo of her in the beach. Should I complain to my boss? The company that we're looking to invest has a reputation of not being in climate change. What should they do? Who should initiate the peace process between Russia and Ukraine? These are questions down to the candidate to be accepted in the School of Medicine. And there are no rules and criteria in responding. It's completely evasive. So this paradox has been going on for some time now. These questions have nothing to do with medicine. So we are speaking that the chances you die in hospital is 1 in 300. And that the solution is sought to this kind of tests that for me does make no sense. So sure, these are important issues, but they are not for the medical students to solve. This is a political issue. At the end of the day, a doctor is a doctor. Being a Russian, being Ukrainian, being Israeli, being Palestinian, the doctor is a doctor. So this is the whole of this practice in non-sustainable. This is the criteria we should follow to avoid all these excesses, because this Casper test means nothing for me and should be abolished. And now there are many critics now, after we started to criticize this, there are many critics on this, and they find it very unusual. So, why science and technology is the best, is the main factor, main pillars of sustainability? Because it is a border and boundary disruptor. You know already that this has been presented 15 years ago, but now they are a reality. The software can diagnose cancer better than human. Software will scan a retina, give blood analysis when you breathe in a device. Software will identify any disease, and software will recognize face better than humans. Today, it's possible, we are almost there. I presented this about 10-15 years ago, and we are almost there. But this is achieved by scientists, this is achieved by doctors, this is achieved by people that know physics, chemistry, and multidisciplinary, multi-specialty people in medicine and in science. Sure, everything else is important. The question is the priority. We have to follow the three pillars of the criteria for sustainability and the three pillars that makes it happen or hinder sustainability. As you see, the sustainability concept we have, it's completely different. We don't allow excesses, and politicians already most of the time forget, and then they act post-mortem. So they see, okay, we have a disaster, they do not prevent, but they act post-mortem. If you follow our sustainability framework, there are no excesses. So, achieving sustainability through science and technology is in the basis of our activity in FLOGEN Technologies Inc., but also FLOGEN Star Outreach, which is a non-for-profit organization that organizes every year big multidisciplinary summits with more than 50 symposia in many fields. And the idea is to achieve sustainability through science and technology. All the other aspects are important. I'm not against all that, but at the end of the day, the science and technology you people here in the room are the most important people in the society, but I think society doesn't view it this way. So, this is, as we organize conferences every year, this time we go around the world, different countries, different continents, and this time is in Cebu, Philippines, and one of the symposia here is dedicated to Professor Haruhiko Inofusa. He is here, I think. We honor people dealing with science and technology and medicine for their long contribution to science. This symposium is dedicated to him. The field is oxidative stress. We have 10 Nobel laureates participating, and if you have a chance, you are all invited to participate. Still, the abstracts are still accepted for a limited time. So again, this is part of our sustainability criteria and sustainability framework, FLOGEN Sustainability Framework. If we don't honor people dealing with science and technology, we are nowhere, and we are not sustainable. So thank you, and you are welcome to participate. It's a little bit urgent to speak up because we're closing soon, but still there is some time. So this is our FLOGEN Sustainability Framework. I try to cover a little bit of molecular science, drug development, and using of that, because all these problems to have in the hospital, 90% of them is using and misusing drugs. So this is all related. Thank you very much. My next paper will be by my colleague. It will be purely scientific on his discovery on the cure on Alzheimer's and Parkinson. Thank you very much.